Hello, my name is Delaney Wolfe, and I'm a pharmacist completing a specialty residency in hematology oncology at The Ohio State University. This year, I've completed a retrospective analysis studying the effect of letermovir for CMV prophylaxis in patients who received allogeneic transplants and also developed graft versus host disease. So there are definitely unique challenges in this patient population, and these challenges kind of creates a gray area in the literature. And hopefully in the future, there will be a little bit more clear literature and data when that comes out on this topic. So far, we know that the highest risk of CMV infection occurs within the first 100 days post-transplant, which is also during the same time when we typically see acute GvHD develop. However, we also know that the presence of GvHD, either acute or chronic, and the treatment necessary, which is high-dose corticosteroids, can also increase that risk of CMV infection. The current primary CMV prophylaxis option, which is letermovir, has shown significant reduction in CMV infection rates in the allotransplant population, but this was primarily studied in the first 100 days post-transplant, which is naturally because this is where we see that highest risk of CMV infection occur. Some of the challenge with prophylaxis for CMV between acute and chronic GvHD exists in just the differentiation alone. So since GvHD is not black and white, patients can often present with symptoms that could be acute or chronic GvHD. And there's often not a clear point where we can determine that a patient has transitioned from acute to chronic GvHD. With chronic GvHD and CMV prophylaxis, there are many unknowns. Since the rate of CMV infection is lower around 100 days post-transplant, there's typically less routine CMV viremia monitoring, and CMV prophylaxis is often stopped for these patients. However, there may be a role for the addition of CMV prophylaxis in patients with active chronic GvHD, especially when they're treated with steroids, but there's really not enough data yet published to support this routine use in this scenario. But however, this is an exciting new area of study that could really help define some new standards of care for our patients who do develop chronic GvHD and require very long-term steroid treatments. There's also not really enough data published to suggest that CMV prophylaxis is beneficial as a standard of care well past transplant in any allo patient at risk of CMV infection. Since letermovir is very well tolerated, it likely wouldn't be harmful in that long-term setting, but it's important to question the necessity and benefit of including it, which is something we would only find out definitively if there were more prospective studies conducted on this topic. So even though letermovir is very well tolerated that we've seen so far, it's also important to consider if that benefit is going to outweigh other considerations for our patients, such as increased pill burden, if this ends up being a more long-term medication, and also healthcare costs associated with continued use. So while this is a great medication, it doesn't come without a cost associated with it. So that's definitely something to keep in mind just to ensure that the benefit is really helping balance those healthcare costs for these patients and also institutions. So really, there's a huge opportunity for prospective analyses evaluating more long-term use of CMV prophylaxis in our allotransplant patients who develop acute and chronic GvHD. We have that one prospective trial that helped publish letermovir. We also have a few retrospective studies, and mine is kind of included in those that helps us see how CMV reactivation and acute GvHD can react together. But I think there is definitely still some more room for new studies to come out that can help give us some more definitive prospective results and help us to definitively determine the best course of CMV prophylaxis in this challenging patient population. So it's definitely not a black and white answer, but I think there's definitely some new data that will be on the horizon soon to help us clearly define this a little bit better.